Hello everyone, welcome to our channel Nursing with Jinsey. Today our topic is Safe Waste Management in a Hospital. This is the last title under our hospital infection control. Okay, so before going to detail with the safe waste management, we need to know what are the types of waste we can collect from a hospital. So mainly the hospital waste we are categorized into two groups. First one is infectious waste and the second is non-infectious waste. Okay. So what are the types of waste will comes under infectious waste? First one is any materials like any cotton balls or gauze piece or gloves, any materials which has contact with the patient's body fluids or body secretions include blood, urine or sputum or any other body mucus secretions. It has a contact means we consider as that is infectious waste. Okay, that is the first group of waste. And second is anatomical waste or pathological waste. This means any body parts from amputation. After amputation, we are collecting that body parts that also considered as infectious waste. Okay. Next group of waste is pharmaceutical waste. From the word itself, you already got what is meant by pharmaceutical waste. That is the medicines or the expired medicines or the expired drugs materials we are considering as that is pharmaceutical waste, because that also may have a contact with others means may cause serious health issues, right? That's why that also we consider as a hospital waste. Okay, next is cytotoxic waste. This means this also comes under medicinal waste, but this is all the drug waste coming from oncology department or after cancer treatment or any chemo drugs. This group of waste we can call as called as cytotoxic waste. Okay. Then another one more very important group of waste is sharp waste or sharps. This means our syringe after the injection, after any procedure, the syringe, needle, the blade scalpels, the IV cannulas and any glass vials or ampoules which broken or after the use, these all we consider as a sharps waste or sharps. Okay, this also may cause serious health issues for others, so that we need to collect safely and we need to dispose it safely. Okay, so then the second category is non-infectious waste. That is all the waste, general waste from a hospital, include paper waste or any plastic waste and another cleaning product waste. These all comes under general waste. Okay, which may not cause any health issues, serious health issues. That's why we are considering as that is non-infectious waste. Okay, these are the some type of waste we can collect from a hospital. Now coming to our topic is safe waste disposal or safe waste management. How we can do safe waste management in a hospital. Now all of you understood with the types of waste, right? So there are so many groups or categories of waste. So we cannot collect, or we are not supposed to collect these all waste together in a particular bin, right? So this waste management carries more than one step. It's a process. It's not a procedure. It's a process. It contains more than one steps. The first step is effective segregation and collection. Segregation means we need to collect in a separate bin. That means segregation. Okay. So these all hospital waste we supposed to collect in a separate bin according to their category. Okay, the first I told you already about infectious waste like cotton balls, gauze, any other gloves, used gloves, all we consider as infectious, right? So that kind of waste we need to collect in a separate bin. So that is the first step also. Okay, so according to some hospital policies, according to the government policies, according to the local institutional policies, we are using some color coding system for effective segregation and collection. So color coding means nothing but according to each and every institution or hospital, that may varies the color coding, but you all maybe know that in our hospital settings we are using a separate color code bins to collect these type of hospital waste. For example, yellow bin, yellow color bin usually I already seen so many hospitals. Usually we are using to collect this type of gloves or gauze or cotton balls like infective materials. We are collecting in yellow bin or yellow bag. Okay, then maybe there is a black color code, maybe there is red, or maybe there is white for white usually we are using for general waste like plastic or paper waste. Then some hospitals using red code, that means red bag or red bin for amputated body parts, collecting amputated body parts using red bag. Okay, that means it's showing it's infective or infectious. Okay, and the sharp, particularly for the sharp waste, we need to collect in a thick bin, that means in a thick plastic or any thick material, thick bin with closed lid. Like that only we supposed to collect this sharp waste, because it may cause touch with any person's body, it may cause serious injuries, right, serious issues. So we need to collect in a thick bin with a closed lid. Okay, then general waste I already mentioned. So this is a first step under safe waste management is effective segregation and collection. So in our hospital departments we have so many this color coding system for effective segregation and waste collection. Okay, this is the first step. And the second step under this waste management is effective transportation of collected waste. We already collected this hospital waste, right? So now our task is effective transportation of this collected waste from the collected area to the disposal area where we are disposing this waste product. So effectively we need to, or healthily we need to transport this waste material to the disposal area. That should be in a closed vehicle or in a closed truck model vehicle. We need to transport safely this waste material from the hospital department to the disposal area. Why we need to use a closed vehicle means it's not be visible for the public, and also it not be cause for any health issues. That's why we need to transfer or we need to transport this waste material in a closed vehicle, okay, to the disposal area. So this is a second step. And the third step what we need to do is effectively dispose. Okay, how we can do effective disposal? Okay, that should be, the place should be away, far away from the living area or from living people. Okay, because there is any contact with this waste materials means it may cause, I already told you, it may cause very serious or complications for the public people, right? So it should be very far away from living people, and it should not be give any sort of visibility for the public or for the people. So like that area we need to choose to dispose our hospital waste. And now coming to the method of disposal is, effective disposal methods include, the first and very best method for disposing this hospital waste is incineration. Okay, incineration means we are burning out of all these infective waste with a high temperature system. Okay, in a machine, with the use of high temperature system, we are burning out of all this infective waste. Okay, this is a very best and very popular method we are using in a hospital, okay, to dispose our infective waste, including our amputated body parts, anything. Okay, and another method is we can bury out or combustion method for another non-infectious waste, okay, which may not not cause any serious health injuries or health issues means we can do with burial or combustion method. Okay, and another one more method we can use in the hospital is recycling with autoclaving method. That means some hospital items we can use after recycling, we can again use for the hospital purpose, means we are collecting that type of materials in another cabin, another sector we are collecting, and we are doing recycling. After recycling we can use that for again for our hospital purpose. Okay, for that materials we can use autoclaving, autoclave machines. With the use of autoclave machines we are doing recycling, or again we are doing autoclaving or sterilization. We can use again that materials for our hospital purpose. Okay, so this much today. We discussed about safe waste management in a hospital and what are the types of waste we can collect from hospitals, right? I hope you understood with all the points which I have discussed with you. So today this much. Thank you so much for watching my video, and see you in another video session.